Understanding hemophilia. 1. Introduction to hemophilia. 2. Types of hemophilia and their causes. 3. Symptoms and diagnosis of hemophilia. 4. Treatment of hemophilia. 1. Introduction to hemophilia. Hemophilia is a rare genetic disorder that affects the body's ability to form blood clots properly. The disorder is caused by a deficiency in one of the clotting factors that are necessary for blood to clot normally. Hemophilia primarily affects males, although females can also be carriers of the disease. There are two main types of hemophilia. Hemophilia A, which is caused by a deficiency in clotting factor 8, and hemophilia B, which is caused by a deficiency in clotting factor 9. Hemophilia is usually inherited from parents who carry the defective gene, but in about 1/3 of cases, the disease is caused by a spontaneous mutation in the gene. Two. Types of hemophilia and their causes. Hemophilia A and hemophilia B are caused by mutations in the genes that provide instructions for making clotting factors 8 and 9, respectively. These genes are located on the X chromosome, which means that the disease is more common in males, who have only one X chromosome. Females have two X chromosomes, so even if one of their X chromosomes carries a hemophilia gene, the other X chromosome can often produce enough clotting factor to prevent bleeding problems. Hemophilia can range in severity from mild to severe, depending on the amount of clotting factor that is missing. People with severe hemophilia may experience spontaneous bleeding episodes that can be life-threatening, while those with mild hemophilia may only experience bleeding after surgery or injury. 3. Symptoms and diagnosis of hemophilia. The symptoms of hemophilia vary depending on the severity of the disease. Common symptoms include easy bruising, prolonged bleeding after injury or surgery, joint pain and swelling, blood in the urine or stool. Diagnosis of hemophilia typically involves a physical examination, medical history, and blood tests to measure clotting factor levels. Genetic testing can also be done to confirm the diagnosis and determine the specific type of hemophilia. 4. Treatment of hemophilia. The primary treatment for hemophilia is replacement therapy, which involves infusing missing clotting factors into the bloodstream. This can be done on an as-needed basis or as a prophylactic measure to prevent bleeding episodes. There are also medications available that can promote blood clotting and reduce bleeding. In addition to medical treatment, individuals with hemophilia can benefit from physical therapy and exercise to strengthen their muscles and joints and reduce the risk of injury. Counseling and support groups can also be helpful for individuals and families affected by hemophilia. In summary, it is important to understand the genetic and biochemical basis of hemophilia, as well as its symptoms and treatment options. By providing education and support, we can help individuals with hemophilia live healthy and fulfilling lives. Thanks for watching.